in my car today because I'm doing mobile dentistry and I'm taking all of my equipment into a nursing home today to treat a patient. I wanted to tell you something that I started to do in my mobile practice that I really love for my patients. So I always start with a toothbrushing because it's really hard to see their teeth to be able to identify what's going on and get my intraoral photos. So I always start with the toothbrushing with their own toothbrush, and then I use an interproximal brush instead of flossing because it does better at biofilm removal. So this one's from Prox, and you can make it a little bit longer by putting that on the end, and then my patients can rinse this off and reuse it as needed once I demonstrate how to use it in their own mouth, or their caregivers can help them because caregivers might be brushing the teeth. They're definitely not remembering to brush in between the teeth. So this makes it a little bit easier for caregivers to help them as well. And the patient can simply reuse this handle over and over and just replace the very tip portion. Note that I do still have a piece of floss out on my tray. Sometimes I'll use the floss still to check my work, but this one removes so much more biofilm, and then I use that opportunity to teach my patients or their caregivers how to clean in between the teeth when I'm cleaning in between the teeth. So there is a specific handle that you can use that can go in between the teeth and size it so that you know what size your patient's interproximal spaces are. And then there's a whole range of colors that you can let your patient utilize depending on their size of their space. For my mobile patients, it's a lot easier just to pick the one because adding on multiple things can feel very overwhelming. So if the space is wider than the brush, then I'll have them do this, which I learned at the iTop event. I'm going to have them put it in towards the mesial, rotate it forward, and pull out like that. And then you cover that whole space. And look at that. I have no bob, no bleeding on brushing. Learned that one from Sarah Jackson. And then as I go along, I have a 2x2 gauze that I'll just wipe it off and then go in between, wipe it off, go in between, wipe it off, go in between, and then I'll rinse it off at the end of the appointment for the patient. The new Wilkins textbook says the interproximal brushing is better than flossing because all those cute little bristles remove way more biofilm. They make them now so that that wire is so small. Blue one is the smallest one, and it will fit between most areas. And if it doesn't, then you still gotta floss some of those more narrow spots.